Good morning, everyone. In the interest of time, we'll go ahead and start. My name is Frances. I work with the Kunle Hassan Eye Foundation Academy. I welcome everyone to another lecture series from the Kunle Hassan Eye Foundation Academy. This is the first lecture of our Community Ophthalmology series, and we'll be looking at the topic Community Eye Health Project Gateway Axis as a case study. I'm doing the welcome and introduction now. After that, we'll take the presentation from the speaker, the interactive session, and the closing remarks. Just a few house rules. If you are not speaking, please have your microphone muted and your camera turned off. This lecture is being recorded, so we want to get the best out of the lecture. If you have a question towards the end of the lecture, you can please type in the chat box or feel free to raise your hand and you'll be called on. I give a brief overview about the Kunle Hassan Eye Foundation Academy. The Kunle Hassan Eye Foundation Academy is a member of the Eye Foundation Hospital Group. Eye Foundation Hospital was established in 1993 with a vision to eliminate avoidable blindness. The Kunle Hassan Eye Foundation Academy was formerly known as the Deseret Community Vision Institute and is the arm of the Eye Foundation eye care system that oversees training of residents, fellows, middle-level ophthalmic practitioners, optometrists, and ophthalmic nurses. Our speaker today is Dr. Tayo Bogunjoko. He's a consultant ophthalmologist and the medical director of Eye Foundation Hospital Ikorodu branch. He commenced his ophthalmology career in 2004 as the second batch of residents at the Eye Foundation Hospital. He obtained a postgraduate diploma in ophthalmology from the West African College of Surgeons and a master's degree in public health for eye care with specialization in community eye health from the prestigious London School of Hygiene and Tropical Medicine in London. He is an alumnus of the International Center for Eye Health in London. He is a fellow of the Hilton Cataract Initiative, which is coordinated by the Johns Hopkins University and the Arabian Eye Hospital. He's also a member of the West African College of Surgeons. Dr. Bogunjoko has vast experience in general ophthalmic care, in community ophthalmology, cataracts, glaucoma, and medical retina. He's involved in the training of resident doctors, community ophthalmic nurses, and community ophthalmic technicians under the Kunle Hassan Eye Foundation Academy, which he has done for several years. He's very proficient in cataract surgery. He was appointed consultant ophthalmologist in September 2010, and he's the assistant director for Eye Health System and Training since 2012. He's the medical director of the Eye Foundation Hospital Ikorodu, which he attained that role in 2017. He is a graduate of the African Ophthalmology Council Leadership Program and is a member of the Ophthalmology Society of Nigeria. So I welcome our speaker today, Dr. Bogunjoko, to the floor. Thank you.
Good morning to you all. Good morning, senior colleagues and colleagues, ladies and gentlemen. I'll be talking on Community Eye Health Project, Gateway Axis as a case study. Our community projects, that's the Eye Foundation Hospital Group community projects, are divided into vision centers and outreaches. Vision centers are also called primary eye care centers. They are fixed outreach centers. Then we have the mobile clinic outreach, which is still being done, called CAMS. So the primary eye care center are fixed, like fixed CAM. Then we will also conduct mobile outreaches where we go about training people. The vision centers are in what we call gateway axis. That is in Shagamu, Ikorodu, Abeokuta, and Agege. So they have a building whereby anybody can just go in and be seen free of charge, and they will be tested and noted whether they just need to be treated. It's a simple eye problem, or it needs to be referred to the base hospital. The base hospital where outreaches are planned are in Ijebu, Mushin, Ikeja, Ikorodu, and Abeokuta. So look at what the vision centers do. So vision center statistics, services rendered. We have the outpatient training. So we see patients that come in free of charge with no consultation. Then if they need readers, give readers, or GV, what we call GV lenses, or the conventional lenses and drugs. So those are the services rendered in the vision centers. So as I said, in the Ikorodu, Abeokuta, Shagamu, and Agege, the performance in 2022, the total OPD seen was 4,831. And we have the most patients seen in Shagamu Vision Center, followed by Ikorodu Vision Center. Advice for cataract surgeries, 382 in 2022. Cataract surgeries done from these vision centers, 47. Lenses dispensed, 356. Readers dispensed, 795. Then GV lenses dispensed, 16. And drugs sold, 4,549. This is showing us the average patients we see per day in these vision centers. The target of patients to be seen, it was set at 10 per day. But in vision center in Shagamu, the patients seen per day ranges from 5 to 8. In Ikorodu, it ranges from 3 to 5. In vision center Agege, it was started. Vision center Agege was started in September last year, so it ranges from 3 to 9. For Abeokuta, it was started in March 2022, and it ranges from 2 to 5. This is showing percentage of drugs bought and optical against advice. That is, the blue line shows medicine prescription ordered against prescription given. That's when the doctor prescribed medicine in the vision centers, how many people bought the drugs or the eye drops. So the blue one is the medicine prescription ordered against prescription given. Then the red line is the optical acceptance rate. That's how many people ordered, got the glasses that are ordered. So as you can see, for the medicine prescription, the people that ordered, the percentage ranges from 13 to 57%, or 54%. For the optical acceptance rate, the percentage ranges from 21 to 65%. That's for Abeokuta. For Shagamu, we have the medicine prescription against order here, which ranges from 58% to 79%, so 82%. So the people that got the drugs, percentage per month ranges from 58% to 82%. For Ikorodu, the medicine ordered, the percentage ranges from 65% to 90%. For glasses ordered, the acceptance rate ranges from 70% to 100%. The Gateway Access Hospital clinics, they are found in Ijebu. They know this one is an optical center. Then in Ijebu Mushin, we have private and public-based hospitals. In Ikorodu, we have the base hospital in DEC, that's the Desert Eye Clinic in Ikeja, and the Eye Foundation Hospital, the base hospital in Abeokuta. These are secondary centers. So outpatient seen acceptance rate for optical center in Ijebu. The blue line, the blue bar shows the total patient seen. The yellow bar is the target OPD. That's the target that was set for patients that will come in per month. The brown line is the optical acceptance rate, and the gray line is target acceptance rate. So as you can see from the optical center in Ijebu, the total patients ranges from, so the outpatient target is 80, was set for optical center in Ijebu, and the highest that was seen was in August 77. Optical acceptance rate target 75%. That is, out of the people that to order for glasses, 75% to order out of those advised. So, but the highest we saw was in October 2022, which was 70%. Average acceptance rate was 50%. But for each month, the highest we saw was in October, which is 70%. This is outpatient seen and acceptance rate. That's for optical in PECC in Shagamu. The outpatient target for Shagamu was 103. Optical acceptance rate target 75%. Highest that we saw was 74% in January. But the average acceptance rate, that's for the optical acceptance rate, was 51%. This is for the Desert Eye Center in Ikeja, which is equally a secondary center. The outpatient target set was 354. Highest was in May, which is we saw 317 patients. Optical acceptance rate target was 75%, but the highest was recorded in October, which was 76%. Average acceptance rate was 59% for Desert Eye Center. For EFH Abeokuta, the target was set for 364 patients. That 364 patients is the target for EFH Abeokuta, but the highest thing was in June, which was 382. Optical acceptance, the target was also 75%, but the highest was 55% for the acceptance rate for optical. The average acceptance rate was 48%. For EFH in Ikorodu, the outpatient target was 550. The highest that was seen was in November 2022, which was 495. Optical acceptance rate target was 75%, but the highest that was seen was in April and October, which is 68%. So the average acceptance rate for optical was 63%. For Ijebu private, that is Eye Foundation Community Hospital in Ijebu, for private, the outpatient target was 325. But the highest that was seen was in March, which was 355. The optical acceptance rate target was the same, 75%. Highest was seen in August, which was 68%, but the average acceptance rate was 54%. For public in Ijebu, the target that was set was that at least about 793 patients will be seen, but the highest that was seen was in August, which was 899. The target for optical is the same. Highest was 66%. The average acceptance rate was 50%. I now go to outreach. We finish with the base hospital and the PECC now. We go to outreach. For outreach, services rendered for outreach are 1, outpatient screening, surgery, readers, glasses, UV lenses, and drugs. For the 2022 performance, in Ijebu, Mushin, Ikorodu, Dek, and Abeokuta, the total number of patients screened on outreach was 18,454. The highest was the outreach organized from Ijebu, Mushin. The outreach group premier outreach center is in Ijebu-Mushin. So that's where we have the premier outreach center. So they have the highest number of patients screened, 11,314, followed by DEC, which is 2,948, and Abeokuta 2,514, and Ikorodu 1,678. Number of camps, 132 camps were conducted in 2022. The highest was by Ijebu-Mushin, which is 56 camps, followed by Abeokuta 37 camps, followed by DEC 26, and followed by Ikorodu 13. Those advised for cataract surgeries, 22,966. Cataract surgeries done, 831. Other surgeries done, 83. Advised for readers, 6,973. Readers dispensed, 5,853. That's 84% acceptance rate. GP lens dispensed, 32. Sorry, 429. Drugs sold, 3,182. This is showing cataract surgery over the month. That's per month. So the blue bar is those who once advised for cataract surgery. The red line or the brown line is those operated. Then the gray line is the acceptance rate. So the acceptance rate for cataract surgery that was advised ranged from 21% to 97%. Those advised was highest in the month of, that's for Ijebu, in the month of June, 242. For Ikorodu, the acceptance rate ranged from 0 to 100%. So we have for Ikorodu, we have 20% in some, 39%, 100%, 33%. For DEC, Desolate Eye Clinic Eye Center in Ikeja, range from 0 to 19 to 27, 29, 46, 70, and 92%. For Abeokuta, it's from 0 to 31%. That's those ones that have their cataract done from outreach. This is showing number of CAM and outpatient screened for Ijebu, for Ikorodu, for DEC, and for Abeokuta. So the number of CAMs was highest in Ijebu, as I told you. Ijebu is our main outreach center in Ijebu-Mushin. So the number of CAMs range from, for Ijebu, to range from 2 to 10 number of CAMs per month. And the number screened range from 366 to 842, to 1,531. That's the number of patients screened for Ijebu. For Ikorodu, the number of counts range from 1 to 4 per month, and the number screened range from 365 to 456. For DEC, the number of counts range from 2 to 4 to 5 per month. Range from 2 to 5 per month, and the OPC strain range from 139 to 740. In Abeokuta, the counts done range from 1 to 3 per month, and the number screened range from 33 to 500. This is showing us the outreach opticals for Ijebu, for Ikorodu, for DEC and for Abeokuta. For Ijebu, the blue bar is readers sold. The brown bar is the GV readers, and the gray is the acceptance rate. So as you can see, it's more for Ijebu, and the readers sold range from from 103 to 738. And the percentage acceptance range from 70% to 95%. For Ikorodu, the acceptance rate range from 67% to 100%. For DEC, the numbers that ordered for the readers' classes range from 77% to 90% to 99%. For the Abeokuta, during the acceptance, the people that order for the readers that are prescribed range from 24% to 94%. Other surgeries that were done per month range from 0 to 12. Other surgeries like pterygium, like palladium, like trabeculectomy. Those are the other surgeries. This is showing us the visual outcomes for this cataract surgery done. This is for the pinhole, that the 618 and better is from 83% to 90%. We have 618 and better pinhole from 83. There's only one in December that we had 76%, but all others that's ranged from 81% to 90%. That's for the visual outcomes for cataract surgery done for outreach patients. For less than 660, to range from 3% to 8% from January to December. Acknowledgement. We want to acknowledge the community partners and external sponsors. We have the Charity Vision as part of our external sponsors, Relief for Human Suffering Foundation, Rotary Club, Lions Club, Brother Youth, and also philanthropic private patients. So these are people that made the uptake that we're able to see for glasses and for cataract surgeries and for other surgeries possible to be as much as we have presented. So we thank them all. We also have internal sponsors that I will not mention. So we thank all our external sponsors and community partners. Thank you.
Thank you very much. So I don't know if we have any questions to ask Dr. Bogunjoko. Any questions or comments to find out more on gateway axis? Dr. Bogunjoko, I don't know, maybe if you want to throw more light on what benefit the gateway axis is, what the benefit of the gateway axis is for the house, so they can get a full picture, sir. Thank you, sir.
Well, the benefit it has for the house is that it enables us to share our experience on the field in the communities that we have been to. We are sharing our experience and for us to learn from each other. Also, it has benefited the masses a lot because of the sponsors. Many people that are not able to come to the hospital, we have been to them. Many people that are not able to pay for consultation, they've been able to we consulted free, and we're able to treat them. So the benefit is vast, both for colleagues and for patients. Thank you.
Thank you, sir. I have a question in the chat box, and it says, thank you for the presentation. Please, the visual outcome of the surgery was at what time frame? At discharge or at 6 weeks? I will allow you to take that question before I ask the second part.
The one we presented here is the first day post-op. Is the vision outcome, the visual outcome is first day post-op.
Okay, and the next question says, oh, sorry. Please go ahead, sir.
I said first day post-op, pinhole. That's best corrected visual acuity for first day.
Okay, sir. The next question says, what is the link between the vision centers and the outreach clinics, since they are located in different areas?
What's the question again?
What is the link between the vision centers and the outreach clinics, since they are located in different areas?
Now, the vision center are stationary. They're in one place. It's a building where patients come to. The outreach, we organize with our community partners to go to various places. So the only link is that sometimes we refer some patients to the vision center from outreach. We refer them to be seen at the primary eye care centers from outreach. Some of them that when we are transporting patients for surgery to Ijebu, we used to ask them to come and stay in the vision center from where we bus them to Ijebu. That was when we were doing that. So the link is that some patients need to be seen properly in the base hospital. So we ask them to come to the vision center. That is the link.
Okay, thank you. Do we have anybody with further questions? Anybody with further questions, comments, or contributions?
Are you hearing me?
Yes, loud and clear.
Congratulations, Dr. Tayo.
Thank you.
It's a very, 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 I would say, very impressive presentation, representing years and years of work. I mean, you presented 2022, but that's as a result of many years of preparation and work over the years to get to this stage. So congratulations to you, your team, and everybody else.
Thank you.
Yeah, so my comments, it's a very good presentation. You can enrich it by adding a map that would show where you're covering, where the centers are located, where the camps are held. So we have a visual picture of the area you're talking about. And alongside that, if we want to look at the patient's perspective, some information on access. So as you're doing this, what's the distance that you have cut down? What's the distance between you and patients? So with the provision of the camps and the vision centers, you have cut down the travel time and the distance between care and the patient. So that's a patient's perspective. So you could do your access information on that, and you could do your coverage information on that. The next one is what you presented is like the numerator, those that got the service to and those who have taken up the service. But you should also give us an idea of the denominator. That is, what is the total population of that area, of what percentage are you reaching? So that kind of information. The other one is who else is out there giving care apart from yourselves? What other eye care services are available? That kind of information is useful. And is there any forum where all the people who are providing care to that population come together, meet, and plan, so that you're not just independent people providing the information? So those are just my few points. You touched a bit on the quality. Just try and see that you match your quality indicators to what is accepted in WHO global indicators. So just match what you're doing with the indicators that are now required, which is the effective cataract surgical rate and the effective refractive error coverage. See if you can, it's a bit of more work, but see if you can do that so that you align with the global presentations. Thank you very much.
Thank you, ma'am. Thank you. It is noted, ma'am. Thank you.
Thank you so much. I have another question here that says,
sorry, before I go, add a research arm, add a research team to your work. You understand? Yes.
Yes. Yes. Thank you, ma'am.
Thank you very much. I have another question here. It's a comment first and a question. It says, great job being done. What challenges have been faced in the community gateway access?
Yes, thank you very much. The challenges we face is patients complaining of lack of funds, lack of money to buy glasses, lack of money to buy drugs, and lack of money to do surgeries. Excuse me, because we charge the token for glasses and for surgeries. But even with the low cost for surgery, the patients still complain of lack of funds. Also, there's fear of surgery. There's fear of surgery, that my eye will be touched, my eye will be operated on. Some are very fearful. Then some don't take up the surgery because they are still seeing very well with one eye. There's one eye that is a HM, one eye is 618. So they feel there's no reason yet to do surgery. Those are some of the challenges we face.
Okay, thank you. Any other questions or comments? Contributions? Okay, in the absence of no further question, we'll bring this lecture to a close. Please feel free to follow our handle on YouTube, the Kuli Hassan Eye Foundation Academy. There you can catch up on our previous lectures in our various series under Retina and Founder series as well. Thank you all so much for your time. Thank you, Dr. Bogunjoko, for taking the time to present this. And thank you everyone for joining. Thank you.